Hey, what is up guys? It's Dr. Sammy, and today I want to update you with current news on how this pandemic is affecting dentists across the United States. It's really unbelievable what has happened in the past couple days, and every day we're getting new information that affects how we will practice dentistry. Right now, it's starting to become mandated that dental offices close to everything except emergency care. Some states have mandates in place, while others are operating under a strong recommendation. Now, the ADA has since come out with a guideline that tells you the difference between emergency care and routine care. And I've included an attachment that goes over these guidelines in the description below. Some examples of non-urgent procedures include initial or periodic examinations, routine cleanings, orthodontic care, and much, much more. So once again, go to the description below to download that table that goes over what is considered urgent, emergency, and routine. Now, if you are seeing emergency patients, there are some precautions that the California Dental Association recommends. Some of these recommendations include patient screening protocols, having the patient rinse with 1% hydrogen peroxide prior to beginning treatment, using a rubber dam whenever possible, high vacuum suction, and there's more to that list as well. Now, there is a debate going on about what is considered proper PPE when operating under this pandemic. Currently, the N95 mask is a recommended mask for airborne diseases such as the coronavirus or tuberculosis. The CDA also recommends that you use an additional face shield for splatter protection. I actually tried to see if I could use my loupes under a face shield and see through my loupes, and the answer is yes. It does get a little bit tight, but if you adjust the light as well as the loupes underneath the face shield, you can make it work in case you have an emergency situation come up at your office. Now, I'm unaware of any mandates that require you to use a certain mask when operating under the emergency setting that the ADA recommends. So if any of you guys know any mandates or any laws that tell us what is required to use while we're working, please let me know. News is being updated every day, and the more information we share with each other, the better equipped we're going to be to handle emergency situations. Many of us have large student loans that can be a financial burden as we don't know how long we're not going to be operating under normal conditions. The good news is that a couple days ago, the government waived interest on all federal student loans. Yesterday, they have given students the options to defer payments on all federal student loans for up to 60 days with no penalty. Now, if your loans are not through the Department of Education, as of right now, you still have to pay interest and make your regularly scheduled payment. So I would recommend that if you want to defer your federal loans, call your student loan borrower immediately. Additionally, the Fed rate is currently at 0%, which means lenders are lowering their interest rates for those that want to consolidate and refinance their federal student loans. Is this a good idea right now? I'm not entirely sure, since you're getting 0% interest from the federal government, but you should know that the interest rates are lower. Okay, so two more updates that I want to talk to you guys about are Sba Loans and Taxes. The U.S. Small Business Administration is currently offering low-interest capital loans of up to $2 million for those that need to pay certain debts, fixed payroll, or other business expenses. And the IRS has just delayed tax payments to July 15th. So please call your accountant if you want to delay your taxes a bit further. Yesterday morning, I watched an awesome video from the CDA that talks about how to handle employee benefits and payroll. The video addresses a lot of the concerns from practice owners across the United States. Highly recommend it, and it's attached below. I'm going to keep you guys updated as things develop. You know, I've noticed a lot of public shaming on social media forums. I don't think it's necessarily the time to shame other dental professionals. We need to try to unite in these trying times. I hope everyone stays safe and healthy. And if you guys want to reach me, I'll leave my contact information below. Thank you for watching the video, and I think we'll get through this, but I do think it's going to be a little bit of time till we do that. Stay safe and healthy, and I'll see you next time.